Hi everyone, I am Micah Guidry. I am the manager here at LaBelle Cosmetic Surgery Center.
Hi, I'm Dr. Jay Apurrao. I'm the cosmetic surgeon here. I'm board certified in general surgery, diplomate of American Board of Cosmetic Surgery.
We're going to talk about the differences between liposuction and abdominoplasty, which is commonly known as a tummy tuck. We hear a lot of patients that come in that don't really know the differences, so we really want to inform you today. Main difference right off the bat, liposuction removes fat, tummy tuck removes excess skin. So Dr. J, tell us, how do you determine what patient needs what?
Wow. Let's go back a little bit. Liposuction, let's talk about liposuction first. That itself is confusing to a lot of people. Like she said, simplistically, liposuction sucks fat. But there's laser liposuction, there's ultrasound assisted liposuction, there are so many equipment, there's cool touch, non-invasive liposuction, all sorts of things in the market, very, very confusing. All of them work in different ways, but everyone claims to be the best. It's not so. The gold standard even today that no one has replicated is the old-fashioned physical suctioning of fat through small holes. Even today, everyone does it at all times despite all the equipment available otherwise. Now, except for the non-invasive stuff, let's go through that a little bit. Non-invasive liposuction is not liposuction at all, such as cool touch. They freeze your fat and the body absorbs the fat, so the size goes down a little bit. But it doesn't shape you as well as a physical liposuction that we can specifically go and remove more one place, less another place, different kind of things. But these procedures can be combined or individualized. Some people just require only non-invasive procedures. Others require fully invasive procedures. Some people they can combine them. It is very confusing because there are so many products available in the market. So be sure to understand everything and answer that question before you do any of them, including the old-fashioned liposuction. But even today, the old-fashioned liposuction, which physically removes fat and shapes according to the location of the body where it needs to be shaped, is the gold standard. Liposuction is basically done by small holes in different parts of the body, strategically placed to remove the excess fat present under the skin. There are so many cannulas sizes. Some of them are very small, some of them are very big, depending upon the volume needed to be taken out and the location. It suctions the fat out. Now, it can be done under general anesthesia or local anesthesia and sedation. We do everything under local anesthesia and sedation. Liposuction has a bad rap in the past because there were lots of complications. This is a long time ago. But the newer technologies such as tumors and liposuction has simply dramatically reduced those complications. The bleeding is almost negligible. People don't have those complications anymore. If you do it outpatient, you walk home, walk back. You don't even need Tylenol for pain. It's that kind of procedure. After the liposuction, recovery is very easy. Most people go back to work as long as they don't do anything strenuous. Almost immediately, in a couple of days, 3 days, they go to work. But you have to wear the garment for a while for the skin to stick with the muscles and heal well. We do a lot of liposuction, one of the easier operations we do. Patients are very happy with that. And remember again, this is the time to think about using that fat anywhere else, like Brazilian butt lift, or fat in the face, or breast, or some other place. That's liposuction. Anything else about liposuction you have?
Afterwards, I did want to add, it's tiny holes that we're sucking the fat out, and all the tumescence that we put in, all the numbing, it's going to drain and it's going to be bloody a little. So for a couple days, it's going to be kind of gross. So patients do just know that is something that happens. But after 24 to 48 hours, it's fine, and patients wear that garment underneath. It's like a girdle that a lot of women or Spanx tend to wear. It goes right under your clothing, and no one will know that you had anything done. And it's a fairly easy recovery.
Liposuction can be done any part of the body, really. Even though 80% of them are around the trunk. It can be done in the thighs, the legs, in the arms, in the breasts, in the back, chest, neck, any place, okay? Side of the neck, face. So liposuction is a very versatile procedure we can use anywhere, relatively very safe. one of the safest procedures we do here.
And with that, liposuction, there's a fine line of skin contracting
Yeah.
afterwards in certain parts of the body, which is the borderline of patients that need tummy tucks afterwards. So let's talk about that.
Yeah, and the thing is, people talk about laser liposuction. Of course, we do them here too. Everybody else does. Laser liposuction is there. There are some benefits to it. The main benefit really is for the surgeon. It liquefies the fat, and I can suck it out easier. But the second benefit is it contracts the skin a little better. You know, the benefits of that is hardly visible to the patient most of the time. In fact, it doesn't work on patients who smoke. Doesn't work on patients who are diabetic. It also doesn't work on patients whose skin is very stretched. You have to be almost near normal skin, healthy skin, for it to even benefit from laser contraction of the skin. Now, bodybuilders benefit very well from it. Their bodies are already very good. They want to just tighten up and see the six-pack in the belly. Laser is the way to go. But laser also has its complications. You can burn the skin off some areas. Of course, we don't burn the skin because we're very careful. Most people are extremely careful, aware of it. But it is a complication that can sometimes happen. And you go home with a scar that you never had. So you have to be careful about it, ask questions about it, and use it carefully. It can be done. It's very beneficial, mostly to the doctors, sometimes to the patient. Now, people think that, you know, you have a lot of fat, you take the fat out, everything's going to sink back into beautiful shape. It is not so. There are two aspects to it. Taking the volume of fat is one, but your body has to contract the skin to where it used to be. Remember that there's a physical law called Starling's law. A spring, stretch the spring a little bit, comes back to normal. A little bit more, comes back to normal. You stretch it all the way, it doesn't come back to normal. That happens to the skin. So, a regular fat stretches your skin to some extent, moderately obese, not moderate, plump to obese. You take the fat out, very often the skin contracts. Healthy, young people, non-smokers, non-diabetic, it contracts. And all you need is liposuction, which is half the patients. But many patients then, liposuction is going to get you back in beautiful shape. It doesn't. After taking the fat out, the skin will start hanging. Then you need to remove the excess skin. This is where the tummy tuck comes into place. You're really removing skin and some fat by cutting it out. So that's tummy tuck. So that we're going to a whole different ballgame right now. So a lot of patients require liposuctions and tummy tuck. Pregnancy, hormone, weight gain, weight loss, and massive weight loss patients, especially after the weight loss surgery, we get a lot of patients for this reason. Then we have to do liposuction, a lot of liposuction actually, and that'll make the skin hang even further down. Then you have to measure the skin and remove it. Make a new belly button, take a big scar and remove this. That's the only way you can get a good result. That's with the tummy tuck. That's a bigger operation.
So patients that come in, they're not always mentally prepared for a tummy tuck because of the incision. It's scary because it is large. But what we tell you is you can work out all you want. You can eat healthy. Some fat will shrink, but the skin will not contract a lot. And so that's where you need to be mentally prepared for a tummy tuck. You need to know it is a more invasive procedure. It has its complications and its risks like every procedure. But that's the only way to get and achieve that result that you're looking for. And when we talk about the borderline of patients that need tummy tuck versus don't need tummy tuck, some cases, and that is only judged by the physician, by the surgeon, there are some patients that can get away with doing liposuction first, giving it time to heal, looking at it, and then deciding how much skin is there to actually be removed. But again, that's not something that the patient really knows. That is judged by the surgeon and by the professionals, because we see that often, and we can tell you the elasticity of your skin and how much it will contract. And in a lot of cases, we'll tell you if it'll hang too much, and liposuction by itself won't be an option for you. So that's something that we look at, and tummy tucks is not just removing excess skin. Some cases we repair muscle underneath. After pregnancy, muscles can separate, right?
Yes.
So we'll go in and repair that if possible. And go into more detail about that. How do we do that?
Yeah, tummy tuck is, we do a lot of liposuction first to make sure as much fat can be removed before the surgery itself. What that does is it brings in more tissues from the side of the belly into the skin. So in other words, we actually remove more skin after the liposuction than without it. So we do liposuction a lot. We do what is called lipo-abdominoplasty, lipo-tummy tuck. So we always do lipo and combine with tummy tuck when you need it. So it recruits more skin from the waist down into the lower belly. So we actually get to take even more skin after the lipo than without it. So we have a scar from one side to the other hip. The scar usually is hidden very well under the panties. So we lift the whole abdominal skin and bring it down, make it separate it from the abdominal wall, bring it down, find the right amount of excess that is required, and get rid of it. Make a new belly button for the same patient. One thing you do have to know, this is not a minor procedure. This is lots of complications to it. Smokers and diabetics have a lot of complications with this. Very often, most surgeons may not even do it on a smoker or a diabetic, certainly not a combination of smoker and diabetic. One of the main things you have to know is the blood supply to the wall, abdominal wall, is seriously diminished with this surgery because of the cutting that is involved. So it's a complication that makes the skin in the lower part of the abdomen can die because the blood supply is diminished. That's the way the surgery goes. In our facility, we do the most recent technique involved, which preserves as much blood supply as possible. Just as the patient is worried, we are also worried. Nobody wants that complication, but it does happen. If I keep on doing it, I'm going to get some patients. So you have to be aware of that fact. We talk about it before we even do anything else. And that can result in a bad complication with a bad scar. Even though it is not as common as it sounds, but if it happens to you, it's 100% to you. So we do all kinds of things to minimize that in this facility. But if it happens, we will take care of it, but without any extra charges.
We do also hear a lot of patients that when they're researching specifically a tummy tuck, they say, I don't want the nasty scar, or I picked this surgeon over this surgeon because this scar looks better. You have to keep in mind that area has a lot of tension. The way that the scar comes out is not necessarily something that the surgeon does, it's the way that your body heals. The more tension we're putting this incision together, the more likely it is to stretch. The more up and down movement you do, the more likely it is to stretch, and the way that your body is going to take. So there's a lot of different issues when it comes to scarring. Not every patient's going to have a perfect scar. Again, we do everything possible to treat it, to show you how to keep your scar thin, but that's not always something that we can control. So keep that in mind too when you're looking into these procedures, and know it's not necessarily a doctor's fault, if you will, for doing it that way. Your body's going to do what it wants at the end of the day. So just know this is a large procedure. This is something to mentally be prepared for, to be in the right state of mind, but also knowing when you're going to have liposuction that this is a possibility. And just to add in there, our larger patients sometimes don't get just a hip-to-hip cut. There is a fleur-de-lis cut that comes up and down and this way because of the amount of excess skin. So that is another option that of course we talk to you about. We only bring it up when it's really something that we're concerned about having to do, and that's really only judged on the table when we're doing surgery, but we do prepare you for it.
Many surgeons usually do this in the hospital. We do it in our office. Our patients walk in and walk out. That's not to say it's a minor surgery, it is a major surgery. There are certain times we may not do it in the office at all. And like she said, the fleur-de-lis, somebody whose skin is so stretched, there's so much excess, no matter how much you put it down, there's too much excess still left. Then we have to cut in the middle too. Then you have a cut in the bottom and in the top. So that's a fleur-de-lis. That is one of the biggest operations we do. Having said that, those are also the happiest patients they have because they don't have skin hanging anymore after that. After the procedure, in this facility, we hardly ever use a drain. A drain is something commonly used to drain out fluid from under the skin after the surgery. Instead, we make a hole in the skin that drains by gravity out. The drain is a difficult problem for the patient to maintain after surgery for a couple of weeks. In my experience, it has not produced any better results or less complications with or without drain. So for years I used to use it, now I don't use it anymore, and I have not had anything to regret, and it makes the patient feel so much more comfortable. Patients come in walking the very next day to my office, and next week, and 3 months, 6 months, all our procedures, we follow up to 6 months for the same price that we charge from the beginning without any other extra.
This procedure also is not to be used as a weight loss procedure. We do strongly encourage our patients to, you want to lose the weight you want first, or try to, because after this, your body's going to go through a lot of changes. Once we lipo certain areas, that fat is gone for good. So after the surgery, we strongly recommend keep it up. Work out, eat healthy, take care of it as much as you possibly can, because if you happen to gain weight, or lose too much, everything that we did is going to change, and gaining weight is going to gain triple elsewhere that you didn't have liposuction done. So that's another thing to think about. We do have lots of patients that try to lose a bunch of weight first, and that's more than acceptable. Just know, reach a limit, reach a goal, and then come in for your consultation, because us being able to see you and judge what procedure that you have will be determined at that weight specifically when you're here. So
in other words, we would like your weight to be stable for at least 6 months. For example, people have undergone gastric bypass and things like that to lose weight. They rapidly lose weight, like 300 pounds to 140 pounds or something like that. But they come back up afterwards to 160, 180, maybe 200 and stabilize. That is when to consider the procedure, not when it's very low or when it's very high. And you have to be stable at least for 6 months. And your natural habits of diet and everything should be stable, exercise should be in progress. Then you get very good results. Whereas if you keep losing weight after the procedure, or put on weight after the procedure, the results are not going to be very pleasant.
So these are a lot of things to think about, a lot of research to do. Again, when you come in for your consult, Dr. J will sit down with you and talk to you about every possibility that you have, every option that you have, and give you the best opinion that he can. So when you're ready, call us for your consultation.
Thank you very much.